Awesome. Okay, great. So welcome. Happy March, everyone. We have a pretty packed agenda, so we're going to go ahead and just get started and jump right into it. Also, please let me know if the slides are changing. We've been having technical difficulties earlier today. So we're going to have announcements, epi update as always. Um, Pima County's environmental education presentation is going to be happening. Uh, is going to have a presentation, and then also a youth mental health first aid presentation, and then our folks over at Oral Health are going to be doing a cavity-free AZ dental sealant program presentation. So with that being said, again, the only announcement is, of course, please subscribe to the newsletter. I also want to let everyone know that our last school health update call is going to be May 8th. I just wanted to give a 2-month heads up, just in case anyone needed to prepare for that. With that being said, I know that Eliana is not here, but I'm wondering, Jake, are you on the call?
Hi, yeah, I'm right here.
Okay, cool. The floor is yours.
All right, great. So as Christopher said, Eliana is not here today, so I will be giving the EPI school health update. You can go to the next slide. So for this month, we have two major updates. The first is our normal RSV, flu, and COVID update, as well as an update on respiratory guidelines that the CDC just announced last week. You can go to the next slide. So as you can see right here, we have our COVID yearly report. Our total cases have been pretty steady for the last 2 months or so. As you can see, we're significantly below the 3-year average for COVID for the last 3 years. The average, by the way, it's a 3-year average, not a 5-year average. This is just keeping in line with the CDC and ADHS, how they're reporting everything. So you can actually compare the total number of cases that we have in 2023 to this year, which is 31,745 to 4,180, which is a 95% decrease from our 3-year average. Something to keep in mind is that over a third of these cases are in individuals aged 65 and over. And we have seen a slight decrease in cases, but one thing that you do need to keep in mind is that there is a lag in case reporting. So these numbers aren't set in stone and they are privy to change on a week-to-week basis. You can go to the next slide. Here we have our influenza seasonal report. As you can see, our cases are still very high in comparison to our 5-year average. However, in our most recent update, the cases are below the 5-year average. We do have and how many confirmed cases are there? We have 3,709 confirmed cases, which is over double from the 5-season average. And individuals aged 19 to 49 are the most affected, with about a third of all flu cases occurring in individuals of this age. And last week, we saw that there were 90 cases, which is a 27% decrease compared to the previous week. But just like COVID, these numbers are subject to change because there's always going to be some sort of lag in disease reporting. You can go to the next slide. And then finally, we have our RSV seasonal update. Similar to flu, we can see that RSV is significantly higher than our 5-year average. Currently, we have 1,215 confirmed cases in our 2023 to 2024 respiratory season, which is a little bit more than double the normal amount. Again, just to note, children aged 1 to 4 are the most affected by RSV, with about a third of all RSV cases occurring in individuals of this age. And we also saw 37 cases last week, which is a slight decrease of 12% from the previous week. However, once again, the data are provisional and are subject to change just because of lags that exist in disease reporting. Does anyone have any questions about case counts before I move forward? Okay, great. So just moving forward, this is a slide that you'll probably recognize if you were here at previous sessions, but just important things to note. vaccines are safe and effective, and you should get vaccinated to protect against the three main respiratory viruses, which are COVID, flu, and RSV. You can get your vaccines at the same time. I personally got my COVID and flu shots together. Made it a little bit easier, actually. Our clinics do offer a variety of services. However, something to note is that there will no longer be COVID testing at the Abrams Public Health Center. You can still pick up self-test kits, but the testing that takes place here will no longer be done. Importantly, you need to stay home when you're sick, and especially take extra precautions if you are immunocompromised or caring for someone else who is also immunocompromised. Good ways that you can stay healthy and prevent others from getting sick are simple preventative measures, the big ones being washing your hands often and thoroughly, avoid touching your eyes, nose, or mouth, wearing a mask, any of the common things. Next slide, please. So there was an update on some of the CDC respiratory guidelines. These are for all respiratory viruses. In our prior guidance, they recommended a minimum isolation period of 5 days, plus a period of post-isolation precautions. However, the updated guidance recommends that individuals stay home and away from others until at least 24 hours after both their symptoms are getting better overall and they have no fever. And this is also contingent on them not using fever-reducing medication. So if an individual has symptoms and their fever has gone away, but they have been taking fever-reducing medication, then their symptoms simply going away would probably not be cause for them to be able to go back out of their house or, around others. Now, depending on the length of symptoms, this period can be shorter or longer than the previous guidance, which was the 5 days. So if you show symptoms and let's say you're coughing and you have a fever, and those go away within 3 days, then that's your isolation period, and then you have 24 hours once those resolve. So the CDC provides active recommendations on core prevention. This is prior to illness, ways to prevent yourself from getting sick. Again, just stay up to date with vaccinations to protect people against serious illness, hospitalizations, and death. The vaccines that we have right now, especially for COVID, are really, really good at that. Next, once again, just practice good hygiene, cover up your coughs and sneezes, wash your hands often, and clean frequently touched surfaces. And then finally, taking steps for cleaner air, such as bringing in fresh air from outside, opening windows, using air purifiers inside, or simply gathering outdoors can help prevent contact from indoor spaces. And then finally, as of now, our outbreak and case definitions have not changed. So they're the same as what they were previously. Next slide, please. So these are just a few examples of the new respiratory guidelines, and I'll just walk through each of them quickly. So in our first example, we have an individual who has fever and symptoms, let's just say a cough. So in our first little bit, we see that the duration varies, but that can be, it could be 1 day, it can be a week, whatever it is. So they have that first quarantine period, and then you can see right before that 24-hour, the dark blue portion, their fever ended and their symptoms are getting better. So once those two things occur, then they wait 24 hours, and then they can go about their normal activities with added precautions. Again, wearing a mask, staying away from people, washing your hands, all that stuff. In our second example, right underneath it, we have an individual with a fever but no other symptoms. So as you can see, once their fever ends, they then wait the 24 hours and then can go about their normal activities. In our third example, we have somebody with fever and other symptoms, but the fever ends and the symptom ends, or the symptoms get better at different points. So again, it doesn't matter when either of them get better, it needs to be both of them clearing up. So in this example, we have the fever ending first and then the symptoms getting better. And only after the symptoms get better can the individual wait that 24 hours and then go about their normal activities with added precautions. And in our final example, we see someone who gets better, but then gets a fever. So you can see that they were symptomatic, they got better, they waited their 24 hours, they went about their normal activities, but then they started experiencing a fever. So they had to go back home, wait until the fever ended, then they got to wait their 24 hours again, then finally go about their normal activities because they have no fever and no symptoms. If this individual started showing symptoms again, then they would probably have to start this whole process over. Not a doctor, but I would probably recommend seeing a doctor if you've experienced, recurring symptoms over a few weeks' time. The main takeaway is stay home if you're sick. That's it. Next slide. So the school guidance hasn't officially updated yet, but it will align with the updated respiratory virus guidance. And the CDC anticipates that this guidance is going to be released prior to the upcoming school year, so the 2024 to 2025. Next slide. And then just a quick touch on measles, because I know it's kind of been a hot button topic. This is just a slide from the previous presentation, but just a reminder is that proof of an MMR vaccination is required for school entry, and the specific doses are required, are usually 2 doses, with the first being administered after 12 months, and the second being administered sometime between the child is 4 to 6 years. There are some exemptions, which include medical reasons, religious beliefs, or personal beliefs, and these are subject to Arizona state regulations. Community or herd immunity is incredibly important, and in order to achieve that, we need to have a certain % of individuals in a population vaccinated. So making sure everyone's vaccinated and up to date is very, very important. We do not have any current updates as far as measles go, but you can see the previous slides or the previous month slides if you have any questions. And if you have anything that isn't answered there, you can absolutely feel free to reach out to me or anybody else in EPI. And then here we just have some additional resources. These are the same ones that were on the previous week, except for in the second group where it says CDC. The background for CDC's updated respiratory virus guidance, that's the full information on the updated guidance that I was going over before. So if you're interested in reading a little bit more in depth there, then you can find more information from the CDC site. And then finally, if you have any questions, you can contact the EPI department at epi@pima.gov. This is monitored regularly and is definitely the quickest way to contact us. You can also do it by phone or fax, but I would say email is definitely the easiest way. We do have some communicable disease reporting available on the Pima County Health Department website as well. So if you want to stay up to date on all of your COVID, flu, and RSV counts and rates, then you can go check them out there. And I think that's everything from me. Does anybody have any questions?
It looks like we don't have. Oh, go ahead, Jake.
No, I was just going to say I'll pass it back to you, Chris. Thank you, everyone.
Thank you so much, Jake. And then also to leave some time at the end, if anyone does have any questions, you can put it in the chat or wait till the end. But we're going to go ahead and move forward. So the next presentation we have with our friends over at the NR. I am so sorry, Maybell. I always butcher your department.
Yes, it's NRPR, so Natural Resources Parks and Rec, which will soon become CLR. So it will be Conservation Lands and Resources, but we're still in transition at this time. Hello, everyone. My name is Mabel Rivera. I am mainly in charge of K-12 programming. I am the program coordinator. Some of you may have come on some of our field trips, but basically I'm here to sort of hopefully give you some ideas of how to include the outdoors and some of that mental health and wellness in your classroom. Next slide, please. So here's the new Conservation Lands and Resources, as it will be called. So we're looking to promote, manage, maintain, conserve, educate, and provide resources. I'm on those 2 bottom halves a little bit more. So I definitely am here as an educator. I was formerly a classroom teacher, and this is my first year out of the classroom. So I am adaptable. There are programs that I'll get into in the following slides that we already have, but I am happy to include some items on mindfulness, and I'm even happy to go into classrooms to do that. And I'm also going to be someone where you can get some resources. If you can't come on one of our field trips, I'm happy to provide those resources. Next slide, please. So here's some examples of programs that we already do. We have a program called Ecosystem Discovery, where we go out and explore the space. We have a little bit more time to just sit in a space, figure out our place in that space, our responsibilities in that space, and how we can give back to the ecosystem and how we are part of it and part of that conservation piece. We have programs called Pollinators and Food. Pollinators and Food is a new program I developed where I go to schools to do some programming in order for kids to understand the connection between pollinators and the food that they enjoy, and just how closely linked they are, and how we can help to protect and promote more pollinators in our environment. We have a program about bat research simulation. It's a popular program around October, which is funny because it's at some points not when bats are around, because they at some point have hibernated, but because of Halloween, I understand why that happens. But a program dealing with measurement and things like that. I won't get into all of the rest of these, but we have programs with nature journaling and habitat restoration, and we go out to a couple of our sites that have aquatic ecosystems that we can explore. So basically we have many field trips. They are all free. So is the school programming that I do in your classrooms. The only thing that you would have to pay for is transportation. So as it marks there, I sadly don't have any more space for reservations for this school year. And however, my email will be on one of the other slides. You may email me if you want to be sort of on the listserv per se that I'm creating for teachers that might want to know about our programming right when the form gets released, so that you'll have first access. But as I said, I can, even if I was doing, let's say, pollinators and food in your class, and you've noticed that there have been some things that going on in your classroom that need some support with mindfulness or wellness, I can for sure include those parts and pieces. So when I reach out to you to confirm a field trip, or if you have questions about that part and piece and how I can support that, I'm happy to do that. I'm actually next week going to a school to help with that sort of task in establishing their outdoor learning space as a space where it can be a place of calm, where it can be a place of learning, but the teachers are not exactly sure how to use that space in that way. And so that's how I'm supporting them. So it doesn't have to be something that's written on paper. I'm happy to help you find ways that really help support what your needs are and what the needs of your students are in your classroom. So the link on there where it says school program information is a link, and it tells you the programs that we have. So if you, I believe we'll get the slideshow, you can click on that and take a look at the programs. Next slide, please. All right, and that basically ends my portion. The lovely child doing some nature journaling. This is my email. It's probably easier for me not to answer questions here unless it's a more general question, but if it's a specific field trip related question, you can totally field that directly to me on that email, because I would really love to work with any and all of you if that applies. But hopefully you can see mindfulness and the use of an outdoor space as a place of healing as well, and as a place where people can learn and thrive. So that's all I've got for you.
Thank you so much, Mabel. Appreciate that. So next, we're going to go ahead and move over to the Youth and Mental Health First Aid presentation. Jessica, the floor is yours.
Thank you. Thank you, Chris. Hello, everyone. I'm going to be talking to you all a little bit about our youth mental health first aid classes that we have coming up. You can go to the next slide. Thank you. So youth mental health first aid is a training that teaches adults how to identify and understand and respond to signs and symptoms of mental health and substance use challenges among children and adolescents ages 12 to 18. So our youth mental health first aid, this is really a class for adults who work with youth or who interact with youth or who are just around you. Because what we'll really be focusing on is those signs and symptoms for mental health illnesses and substance use among the youth. If you go to our next slide, please. So this is really important training for different reasons. And so some of the stats we have on here is like 1 in 5 youth will experience a mental health challenge at some point in their life. 10.2% of youth will be diagnosed with a substance use disorder in their lifetime. And 50% of all mental health illnesses begin at the age of 14, and 75% start at the age, within their mid-20s. So like the median onset age for anxiety is 4 years old. So we have children as young as 4 years old who are starting to experience signs and symptoms of anxiety. And that is a really big deal. And so speaking with all of you today that work with you so closely, this is such an important training to have, because this training is really focusing on like, if you have a youth or a student that's coming to you and talking to you about some of these things that are going on, it's like, what do you do? And so this training is really like going to teach you like, what do you do while you're working with that youth until help arrives, or who you can refer them to. If we go to our next slide, please. So who should know about mental health first aid? So teachers, educators, school staff, coaches, camp counselors, parents, really any adults who work with you should know about this. And again, thinking about this is like, if we think about, we learned CPR, right? And so we learned CPR because if somebody goes into cardiac arrest, the goal is not to, perform surgery of any kind or something extreme. It's really just how can we provide that immediate help until professionals arrive. And so when we're looking at youth mental health first aid, it's the same concept for the mind. So if this student or youth is in a crisis, what can we do with them? Like, how can we help them until further help arrives? So in the training, what we will cover is we will go over signs and symptoms of mental health challenges in youth, and also signs and symptoms of substance use disorders and challenges. We also talk about like common changes in adolescence. So we know that as our like teenagers start to get older, they start going through different changes, and sometimes they just become a little more cranky, and that's just part of growing up. So we will go over kind of like, what does that normal changes and development look like? And what do signs and symptoms in mental health look like, and how they differ? So that way you really have a clear understanding of, is this like normal development, or is there something else that's going on here? So we provide a lot of examples so you can kind of see the differences between those two things. We'll also go over how to interact with a youth while they're in crisis. And what we do is we use the picture here on the screen is our ALGAE action plan. So we walk through this action plan and how you use it. And we also have our participants practice it while we're in our training. We also go over different resources that you can connect youth to help. And then we have some information, some expanded content on trauma, substance use. We talk a lot about self-care and the impact of social media and bullying. So we have 3 trainings coming up this semester. So we have one next week on Thursday, March 14th. So registration for that class is still open. We will be closing registration this Friday. So you have a couple of days to sign up if you're able to make that date. We will also have a training on Wednesday, April 24th and Wednesday, May 15th. So all 3 of these trainings will be in person. They're going to be at our Abrams Public Health Center on Country Club in Ajo. And there is the QR codes there for the link to the registration. We also have a flyer that we can send with Christopher and his team, and they can share it out to all of you as well. And then here is my information. So my name is Jessica Dalton. I apologize. I don't think I introduced myself when I came on. My name is Jessica Dalton. Here is my email address and phone number. And Ana Guerrero is going to be co-facilitating these trainings with me. And here's her information. So if you have any questions or if there's anything that we can do or help you with, please reach out. We'd be happy to help and hope that you guys are able to come to our trainings.
Thank you so much, Jessica. Really appreciate it.
Thank you.
And yes, we will be sharing out that flyer in our next newsletter that should be coming out on the March 11th, so this Monday. So look out for that. Next, we have our cavity-free AZ dental sealant program. Margaret, are you on the call?
Hello, yes, I am.
All right, the floor is yours.
Okay, thank you. Good afternoon, everybody. My name is Margaret Perry, and I'm a registered dental hygienist and program manager for the oral health programs with Pima County Health Department. The cavity-free AZ program has really been around for a long time. I see some very familiar names out there and lots of different schools that we've been to over the years. The program actually started by Arizona Department of Health Services in 1987. And we have been visiting many of the schools in Pima County since then. Pima County Health Department took over administering the program in 2004, obviously still in partnership with Arizona Department of Health Services. We can go to the next slide, Chris. Sorry, thank you. So we have our mobile dental unit that travels around to the various schools in all of the big school districts, AM5, Flowing Wells, Marana, Sunnyside, and of course, TUSD. And our goal really has been since the beginning to increase access to care for the children, identify dental needs, and most importantly for this program is preventing dental decay. Cavities can start very young, as you all know, and we're just trying to identify those children that need dental care and those that need dental sealants to prevent dental decay. You can see a lovely unit we have. It was bought with bioterrorism dollars back in 2005, and it's been a great piece of equipment for us to be able to travel to the schools and provide these services right on site at the schools. So that minimizes the time that children are really out of class for this dental service. Maybe 15 minutes for a second grader and sometimes about 20 minutes for a sixth grader versus a whole day that they might miss of school to go to a dental appointment. So we think it's a very valuable program. We target second and sixth graders because they have the new permanent molars coming in. We also have a supplemental program for fluoride for the kindergartners. Many of you may remember swish and spit used to be a common thing in the schools, and it's no longer being utilized. It's time intensive, cost prohibitive in many cases. So this fluoride supplement program, we actually paint the fluoride on their teeth very simply. I was just at a TUSD school today and we did it right in the hallway, right outside the kindergarten classroom. Very simple and easy to do. And because there are no required dental exams, unlike hearing and vision, this screening at that kindergarten level gives us an opportunity to identify the youngest kids with dental needs. And again, today I identified one child with an abscess, kindergartner with an abscess, not in any pain that he wanted to tell me about, but we will be reaching out to the parent guardian and let them know the situation and see how we can help get them dental care. We were also at the same school doing sealants today, and we saw 25 children, and 2 of those had urgent dental needs, which means pain or infection. So while we love to be there to prevent cavities, we are also there identifying issues that need to be taken care of very quickly. The recommendation is 24 to 48 hours when we identify a child with pain or infection. Thankfully, it doesn't turn into something very serious most of the time, but occasionally it does. So it's our goal to get that taken care of as soon as possible. Let's see. Okay, we can go to the next slide. Thank you. So the Sealant program is a CDC evidence-based program. There's only 2 evidence-based interventions for communities when it comes to preventing tooth decay. Community water fluoridation is one, and school-based sealant programs is the other. Many of you may know that while we have some fluoride in some of our wells around Tucson, we do not have the optimal level of fluoride in our water. So with that one kind of out the door, if you will, I think the school-based sealant program becomes that much more critical to our community. So again, we're really happy to be able to have that. The pictures there that you can see, the top tooth is a permanent molar with pits and fissures, grooves, hills and valleys. We call it all different things depending on who we're talking to. But that's where the bacteria will get caught in the tooth, bacteria and food, and not even one bristle of a toothbrush could get in there to remove it. So again, the goal with these dental sealants is to paint this plastic over the top so that we will seal the bacteria out and seal the food out. The picture right beneath it, you can see a nice little river basically through there. Looks like a little drop of milk. Very simple procedure to do. There's no drilling, no shots. It's kind of like painting fingernails, if you will. We use that with the little girls that might be a little apprehensive, but it's a very simple process, and the kids are really proud of themselves when they get done and they hop out of the chair and say, geez, that was easy, because they might have been a little nervous before, and but it works out very well. We have the numbers of the schools. So in the fall, we completed 25 schools, which was 559 children screened and about 400 of them that received 1 or more dental sealants. Again, 2nd graders have 4 permanent molars, so that's the most they could have, and 6th graders could have up to 8 permanent molars that need sealants. Spring so far, we've completed 15 schools, and then you could see the number, 185 children, and 124 of those received the sealants. So again, we're making progress. We still have more time left in this school year. We've been given special permission by ADHS for the remaining schools to include 3rd grade children in addition to the 2nd grade children. And this is primarily just because we hadn't been to all the schools last year. We don't want to hear as a result of COVID, but there were some complicating factors for dental care in schools for several years. But I think we're past that hurdle. So if your school has not participated yet, please reach out. We continue to reach out to those schools, and we'll see how we can get the 2nd, 3rd, and 6th graders served at your school. Next slide, please. Some great news. We have now a digital consent through DocuSign. We are really the first one in the health department that has had this created for us. We've just barely had it out, but we have QR codes and links that parents can now complete those consent forms online. We will continue to have paper products. It's always a must, but it has kind of shown that this might be another option for some families to be able to complete that form. It can be done on a phone, a tablet, or a computer. And so we're really excited about the potential increase in consents that we may get from that. Coming soon, it's that time of year. I know we're barely to the end of this school year, but each spring is when the invitation to apply for the program for the next school year comes out. So in April, please be on the watch for those letters. It'll be electronic. We'll do an email and let the health offices know that which schools are eligible for the free and eligible for the sealant program, which I didn't mention, but it was on the slide. The schools must be 50% or greater, have the families, 50% or greater of the families eligible for the free and reduced lunch program. That is a mouthful, but there's lots of schools that fall into that category. I think all of Sunnyside, most of TUSD, several in Amphi, Flowing Wells, Marana, and we also do visit charter schools and faith-based programs too. And so I've included Andrea, many of you know, our program coordinator, and my number on there so that you can reach out. And if you have any questions or if it's time to get scheduled, you've got our number and contact information. And we can go to the next slide, which is just a little summary and I guess acknowledgement of National Children's Dental Health Month that was last month. And I think today might even be National Dentist Day, I think somebody told me. So we use this opportunity to thank the dentists and dental hygienists in our life for helping to take care of teeth and serving the communities at large there. We appreciate it. Again, thank you to all the schools that we've been to and participated. Staff is always very welcoming and appreciative, not to mention the kids and the families. But we look forward to serving the rest of you. So reach out, we'll be in touch. Thank you.
Thank you so much, Margaret. I appreciate you.
Thank you.
So with that being said, do we have any questions either for Jake, Jessica, Maybell, or Margaret? If so, please put them in the chat. Seeing none, we will stay on for another additional 3 minutes. But if you have no questions, of course, you can contact us at our phone or email. And I hope you have a wonderful day, a great rest of your week, and we'll see you in April. Have a great day.
Thank you.